Good evening, everyone. Welcome to the MPC seminar. I'm Julia Laszczuk. I'm a research fellow here at the MPC. And it is my great pleasure to chair today's seminar titled How Resilient Were Essential Workers During the COVID-19 Pandemics, Comparison of Migrants and Natives. So we will have more or less 30 minutes for the presentation, and then I will open the discussion. Please submit your questions to the chat or raise your hand if you're here in person. And finally, I'm delighted to introduce our speaker, Friedrich Poeschel. Friedrich is a senior research fellow at the Migration Policy Center. His current work focuses on global skills, partnerships as a way of addressing labor shortages in the context of Horizon Europe Project Global Strategy for Skills, Migration and Development. He also works on migrant employment in key sectors such as health care and food supply chain. So without further ado, Friedrich, the floor is yours.
Thank you very much, Julia. Yeah, I'm glad about this opportunity to also present this work. I've been mostly, as you said, working on a Horizon Europe project, but also this is close to my heart and I want to see it advance. So this is about essential workers during the pandemic. I will start with a little, yeah, let's see. So I have slides. Okay, yeah, I'll just use the, okay, now it is, okay, thank you. So it was the pandemic that highlighted essential workers, that basically gave us a definition that is now widely known, right? These are workers who are working in key sectors, such as health, care, food, anything to do with the food supply, logistics, and other things that could not stop, things that were exempted from the lockdowns. And so the essential workers were also much more visible than before because they were the ones who still had to go to work, whereas everybody else had to stay at home in the lockdown. So that is therefore, like, people have heard of this, and well, they are a group that has attracted therefore some interest. And it has been noted that when you saw this, who's still going to work and who do you still encounter working in the supermarket, in hospitals, in logistics? There were many migrants among these people. So that was widely noted. And then the question for today is, how did these workers, migrants and non-migrants alike, how did they do in the end under the pressure of the pandemic? Because now the data have come in, right? We can do analysis about the years of the pandemic and see how they were actually holding up. And this particular work was carried out at URAG Research and was funded by the autonomous province in Bolzano, where URAG is located, through a mobility fellowship. And here on the right, I'll show you, I can show you like a basic graph about the presence of migrants among essential workers. And as you can see from the title, I'm using essential workers or key sector workers interchangeably. It's, in my mind, it's the same thing, just different words. So the blue bar gives you the share gives you the share of key sector workers who are migrants, and the red square gives you the share of all employees who are migrants. And you can see that the blue bar often exceeds the red square. So in that sense, just without any analysis, just looking at these numbers and employment basically of migrants in certain sectors or occupations, you find that they are often overrepresented. You find more migrants among essential workers than you would think, given their share among all employed people. So, but why, you might ask, like, why are you still looking at essential workers? The pandemic is over. Isn't that too specific? No, it's not, actually. I would argue very much that we can learn a lot of things from the pandemic and from the situation of essential workers for future crises. And this doesn't have to be a pandemic. It could be a war situation. It could be a major blackout, as we've recently seen in Spain. It could be another pandemic. People say that pandemics have become much more likely in recent years. It could be extreme weather events, you name it. So people tend to say that we live in uncertain times, and so perhaps we want to learn as much as we can from the particular crisis situation of the pandemic. And essential workers in this context are really important. So, well, their work and how they work in a crisis situation can literally make the difference between life and death. As a group of workers, they are central to countries' efforts of raising resilience. So to be resilient, to continue functioning as a country, as a society, and as an economy, when there's a crisis situation, it could be, again, a pandemic or another crisis situation. Just, you don't know what's coming, but you want to be well prepared, and you want to adjust to the situation and keep up basically the key services, these key sectors, when the crisis hits. Why are we interested in migrants in this context? Well, because there are quite a few of them, so they, as such, their role is important here for essential workers, but then also because they might have a particular situation, or they might face particular conditions at work, or about sort of their whole situation in the country. I just named border closures here, but we'll come back to this point. Border closures might affect the migrants among essential workers, and mostly not others. And then there's another reason to study this, because the Migration Policy Center has a dedicated project already since 2020. It's called the Migrants Hub. Okay, this reason might not be as good as the first two bullet points here, which are about life and death and resilience. But it is a project, so jokes aside, it is a project that when we started it here was met with really a lot of interest from practitioners. As you can imagine, the whole issue of resilience and preparing for future crisis is quite important to governments, and to those who sort of work for governments, international organizations who organize exchanges on this. So there are a lot of practitioners and government people, policy people who are interested in this kind of work. To give you a quick background of sort of what we know already, it's obviously not exhaustive, and I apologize, there's quite a bit of my own work in there, but that's because we've been working on this since April 2020. So unsurprisingly, people found that essential workers were often more exposed to the pandemic in terms of contagion, especially when they had frontline roles where they actually encounter patients or clients, in general other people who might have been infected with the COVID-19 virus, whereas others were staying at home and were not meeting anyone outside home. It's also been found that essential workers exhibited a higher incidence of smoking and lack of sleep than other workers during the pandemic. Then one of our papers demonstrates that migrants are overrepresented in key sectors in many European countries, even when you account for the composition of the labor force. So to give you an example, if you think, oh, there's a sector or some occupation where there's lots of men and lots of young men, and then you'd say, okay, among young men there might also be many migrants, like more than in other sort of demographic groups in the society. Even if you account for that, for these demographics, you find that migrants are still more likely to work in key sectors than in other key sectors. In non-key sectors or in other sectors. So they are empirically overrepresented in key sectors. And a paper with a colleague of mine, Anton Nivodoshkin, we were looking at essential workers in Germany in particular, and looking at their working conditions, because there we had the data that you need to do this kind of thing. And we found that migrants were especially frequent where working conditions were worse than for the others. So this is within key sectors, which are obviously important. And you'd think that working conditions are good, and we found, yes, by and large they are normally good, but then sometimes they're bad, and then that's why you find a lot of migrants, many more than you would otherwise expect. And we linked this to a lacking proficiency in the host country language, that this is one reason why migrants end up there and find it perhaps difficult to get to jobs with better working conditions. Fasani and Matza found that within key sectors, again, migrants were more at risk of losing their job during the pandemic. This is, in a way, aligns with earlier findings on earlier crises, like the financial crisis. There, like OECD work and so on, has demonstrated that migrants were more likely to lose their jobs during this crisis, which is often because they are at the margins of the labor market or have been recently hired, right? Last hired, first fired, and that kind of thing. Okay, some more findings. Our first paper, and this is very much, this was the first paper of the Migros Hub project, said, okay, if there's so many migrants in key sectors, then should we not rethink policies on migrant employment? Should we not, and on labor migration in particular, but not only, also on employment policies or employment regulations? So should resilience not be a policy goal? So far, policy goals in this context are responding to shortages or finding a balance between responding to shortages or having enough labor supply, but also protecting domestic employment and so on, these things. But resilience is not a policy goal in this context so far. Perhaps it should be. Perhaps it should be if, and then especially in the context of migration policies, if migrants play such a strong role in this context. And indeed, an interesting paper, an experimental paper, found, this is Alan Fernandez Reno and Rios, found that public opinion seems to be more favorable towards migrants in key sectors. Two more points about migrants during the pandemic more generally. So this applies to migrants generally, but probably also to migrant essential workers in particular, that they were more at risk of ending up stranded somewhere because of border closures or because flights didn't go anymore, and so stranded, like you're somewhere you don't have anything to do there really. You're not where your family is, and there's, in fact, another paper finds that this separation from partners and families in this uncertain situation was stressful for migrants, and probably in particular. And you can imagine if somebody in the family at home is infected and you would really want to care for them and make sure they are right, or they get better, and you're somewhere stuck and you can't do that. So this is must have been quite tough in many cases. So the question here is, how did these essential workers do? And I focus on Italy in 2020 with the data that I have. In this context, there's an identification problem. So the pandemic tended to be worse in urban areas where people also have more contact and so on. The virus spread more easily. But at the same time, migrants are also more frequent in urban areas. We know this. So if you just sort of looked at correlations, then you would find, oh, where you have more migrants, you have a pandemic was worse, and things like that. So what you really need to do here is to account for the regional impact of the pandemic. So I want to see, okay, people in the same situation exposed to the same kind of impact, how were they behaving, and how were they perhaps behaving differently if they were migrants or not? And I'm looking at Italy for various reasons, because Italy was badly hit. At the same time, you have a lot of large variation across regions. So this is good to get results, because then you have things spread out over various possibilities and you can do nice comparisons. Also for Italy, it is true, as I show here in the graph on the right, that migrants are more frequent. So these are only key workers here, but migrants tend to be more frequent in the urban regions, EU migrants and especially non-EU migrants. So Lazio, that would be Rome, right? Emilia-Romagna with Bologna, Toscana with Florence, and there's some rural regions like Umbria, rather, and Trentino Alto Adige, arguably, but most of the rural regions are really towards the end of the ranking here. So the identification problem that I outlined would apply here. So, but I'm making distinctions by regions, and I'm using that to identify how people were affected. So briefly, which migrants work in Italy's key sectors? I remember very well reading perhaps more than once that there's no data on that, we can't say by nationality. So I tend to disagree. Here are the data based on the Italian Labour Force Survey 2019 and 20. It stands out that nearly a quarter of the migrants who are essential workers in Italy are Romanian, which seems like really a lot to me. Then there's a good number of Ukrainians, Filipinos, from Moldova, from Albania, from Morocco, and I hope this is kind of readable, various other Latin American and also Asian, like quite a range of countries. So, but that's only on the side. The empirical approach to answer this question, how did essential workers do, is essentially that I estimate the impact of the COVID-19 pandemic on employees. And then I ask, was this impact different for essential workers? And then I also ask, was this impact different for migrants among essential workers compared to non-migrants among essential workers? The impact here is measured in two ways. I didn't want to rely on just one. It's measured as new death relative to population in a quarter. So these are quarterly data. And also in a specific region. So for every quarter in a region, I know whether there were, how many new deaths there were in that particular combination of region and quarter. And I know how many people were currently in intensive care. So they might still be in intensive care, but it's a different variable. It's not new things, it's like the stock of people. And I relate that to population of the region overall. So the estimation equation here shows the y. The y is then this, sorry, it's not the impact variable, it's an outcome variable in which we will look at different outcome variables in a second. The F is an indicator for being foreign born, for being a migrant. But I also look at foreign citizens in this context to again check the results and see if something differs between foreign born or foreign citizens. The I is the impact variable. Then there's the EW, that's the essential worker indicator. And then there's a couple of interactions. But the interesting one is the three-way interaction that you have at the beginning of the second line. So this basically allows, is an interaction between being foreign born, being essential worker, and the impact. The way to think about this is, again, as I said, I have the relationship between impact and essential workers that I'm estimating, and then I allow this to differ for foreign-born and as opposed to others. And the rest of this, okay, the other interactions are part of the same approach. I won't explain these in details. The three-way interaction is an unusual thing. It gets complicated, let's say, and you have to check all sorts of things to make sure your results are interpreted correctly. But I found it the approach, the useful approach in this context. And so there's V and W, they are control variables with aspects on demographics and job characteristics, whatever I could find in the labor force survey data. I can go into details on that, but it's, for example, gender, age group, and whether people have a second job and so on. Also family situation is a list of things. And then finally, the Q and R are occupation and region fixed effects, because this is just to capture things that are just different across this whole time between regions and between, sorry, what did I say for the Q? So I mean, the Q are, yeah, occupation fixed effects. I hope I said that correctly, because this is, of course, things were sometimes widely different between occupations. So you really want to account for occupational groups here, which I can do to some extent at the ISCO 1-digit level. So to just basically make sure to the extent possible that we're not comparing apples and bananas here. Okay, so let's move to results. I think in terms of time, still okay. The first results, the outcome variable is whether or not you're absent, recorded as absent in the labor force survey data due to illness. And here on the left panel is the native born, on the right the migrants. And the red is always essential workers. The blue is other workers, non-essential workers. And this gives you this is the picture of the estimated relationship. You can see down, well, so this is as the impact of the pandemic gets worse, how do things differ? As you go from left to right, the impact of the pandemic gets worse. And we can see that, yes, basically everybody is becoming ill more often, right? As you would expect in a pandemic. Everybody is at least absent from work due to illness officially more often as the pandemic gets worse, or as you are in a region where the pandemic is worse, as opposed to another region where it's not as bad. And this is especially strong for the red line on the left, for the native-born essential workers. So they fall ill quite a bit more often, or they stay home quite a bit more often because of illness as the pandemic gets worse, much more often than non-essential workers, because the blue line on the left does not rise nearly as much as the red line, and you see the confidence intervals, the 95% confidence intervals at some point are almost separate. So you get this is a significant difference. The impact variable I'm using here is people in intensive care, and I'll say more about that in a second, but let's look at the migrants. In the case of the migrants, these two lines are parallel. So there's not really a difference in how key sector workers are responding as the pandemic gets worse, and non-key sector workers are responding when they're migrants. So in a way, we see people getting or staying home sick more often if they're native-born essential workers, but not if they're migrant essential workers. And this is sort of at odds with a lot of literature and guessing, basically, that, oh, migrants have been at higher risk of contagion. They have been more exposed. especially when they were essential workers and especially when they were in frontline roles. And this is, I find this here only for the native-born essential workers, not for the migrants. Why not for the migrants? It could be something related to age, that migrants just tend to be younger, and we know younger people were less at risk of having really a bad COVID-19 experience during the pandemic. Or it could also be a greater tendency that migrants still come to work when they're ill, because the variable only records if you're absent or not due to illness officially, and not whether you're really ill or not. They could be that they were ill and they kept coming to work. Why would they do that? Because they often really don't want to lose the job. It might be linked to their status of being in the country in the first place. It might be that they don't have access to Social Security. It might be that they otherwise wouldn't be able to to make remittances to a family abroad, and this they really want to keep going. So they really want to keep the job. So they even go when they're ill. So that would be plausible reasons for this kind of result. But, and here, well, first of all, I do the same analysis, not for essential workers now, but for people in frontline roles, which are a subgroup of essential workers, okay? And I find basically the same thing, right? So this in a way, this backs up the first result. So why the difference for migrants? I was playing around a bit with the analysis and say, okay, age of course makes a difference, and that I could see also in the results that older people were more likely to fall ill. But if that or the insecure status of migrants, if that was the explanation, then the results should be stronger for foreign citizens. And why is that? Foreign citizens as opposed to migrants who are naturalized, who are Italian citizens after some time. The foreign citizens would be more the new arrivals, right? They would tend to be younger, they would tend to be less integrated than the naturalized migrants, and so on, and they would have a more insecure status. So you would want to see, or you would expect to see this kind of result, especially for the foreign citizens, because there are more new arrivals included, but we don't. So I have the same result for citizens. It's roughly the same. So I don't find evidence here for that particular, or for these two explanations for age, although age of course plays a role and insecure status, but this difference perhaps is not driven by that here. A short comment on which impact variable I'm using: intensive care, people in intensive care, or as here I do new death. Yes, the results differ slightly depending on which you use. And in the first case here, I show you intensive care because it is a significant result. If you use death, the graph looks almost the same, or basically the same, but it's just not significant. So, in the interest of having a significant result here to present, I'm showing you the one for intensive care. But the graphs really normally didn't differ very much, with one exception at the end. So let's move on to another result for weekly hours worked. So this is where the pandemic on the right gets worse, measured in new death. What happens? We see on the left that the native-born essential workers work significantly more hours, so they expand their labor supply, they put in more work as the pandemic gets worse. This is this steeply rising red curve on the left. The non-essential workers, the blue, they might work somewhat more, but it's very little. And probably somebody will ask me about, like, didn't people work less in the pandemic? So we can come back to that, but these are the people who are working. And then for the essential workers, it's not surprising that they were working more. But for the foreign-born on the right, the result is very different. The essential workers who are migrants, the red curve, is kind of flat. You can't say that there was any increase of hours there. But noting that to begin with, it starts at a higher level. It starts nearly 32 hours and stays there, whereas on the left, the native-born essential worker starting at 28 hours per week and then rising. So if you're at a higher level already, it's also a bit harder to increase your work supply even further. But even though the migrant essential workers did not seem to work more hours, that is still a big difference with other migrants, with non-essential workers who were migrants, who were working much less. That's the falling blue curve. So in this sense, there's still quite a big difference. I can't give you too much of an explanation for the weekly hours. I'm still looking into some things, but yeah, other than when you already work a lot of hours, then it's harder to increase them further. And the final result in this context is where the outcome variable is whether or not you're looking currently for another job. Because that's also in the labor force survey. And on the left, we see the Italian citizens. Here I'm showing you citizens, so Italian citizens versus foreign citizens, and not native-born versus migrants, because the only result that comes out of this question is between Italian citizens and foreign citizens. Italian citizens seem to, there's not much going on. As the pandemic gets worse, people seem to even look less for another job, perhaps also because it was, in a sort of economic crisis, it's less likely to find another job. So why would you look? I can only speculate about this one, but there's certainly no tendency here to be more on the look for another job. Whereas for foreign citizens, we can see that the essential workers who were foreign citizens, the red curve, they were much more likely to be looking for another job as the pandemic gets worse. So as the pressure on them in a way rises, they report much more often that they are looking for another job. In contrast to to foreign citizens who are not essential workers, they basically show the same behavior as the Italian citizens here. This result makes a lot of sense, I'd find, because foreign citizens, again, as opposed to naturalized migrants, they would include many recent arrivals, many people who are not yet so well integrated, who have not put down so many roots. So if you're such a person and you are in an occupation in a context where there's a lot of pressure and probably a lot of hard things to deal with, then you think, oh my, do I not have other options? I could easily go somewhere else. They might be more mobile and less committed to this particular place and this particular job, and therefore look for another job more often. So conclusions, I think time also fits with going to the conclusions now. Let me first say that overall my impression was that essential workers, everyone together, essential workers in Italy have shown a certain resilience during the pandemic. Why do I come to that conclusion? Because at least the native-born essential workers increased their hours so much. They put in more work as the pressure got up. And most people, except the foreign citizens, were not looking for another job, right? They were saying, okay, we'll see this through. And in terms of falling ill more often, yes, key sector workers or essential workers were falling ill more often or staying home more often because of illness, much more often than the rest of the population. But this is kind of also what you would expect. In that context, it's only a surprise that you don't find this for migrants. So that's basically the first point here of the conclusions. Yes, essential workers were staying sick home more often, but this was then not found for migrants. For native-born workers, if they are essential workers, they increase their hours a lot, much stronger than non-essential workers. And for the foreign-born essential workers, okay, their hours did not rise, as I've shown you, but they also did not fall. And for the other migrants, they fell. And as the final point, so only essential workers who are foreign citizens, which is a particular group, let's say, they were more often looking for another job, while everybody else was not, which is, again, something that I found surprising, given the pressure and the hardship that many of these people, of these essential workers, had to deal with. Okay, I'm looking forward to your questions. Thank you very much.
Thank you very much, Friedrich. So we have more or less 20 minutes for discussion. If you have questions in the room, please raise your hand. If you have questions online, please put them in the chat, or you can also raise your hand, and then I will ask you to unmute yourself so you can ask your question directly. And I think I will go first. I will use this opportunity to ask you. So we're speaking about pandemics as something that triggered problems, but we all know that those problems are not new. At least many of them are not new. So the pandemic exposed already long-lasting problems of migrants. And I was thinking that those sectors that you described, they are normally, or at least in Italian context, very often irregular sectors. So it was a high share of irregular employment. And irregularity here, I mean not only as working without contract, but in general, this existential irregularity of migrants who, irregularity of their stay, right? So they don't have the documents. So I was wondering if you looked deeper into this, how irregularity affected these risks related to COVID, and maybe another thing, you were speaking about the risk of contagion, as that there might be various answers to this question. So what do you think if those numbers were just not like underreported exactly because of this issue of irregularity, because everything is interconnected, right? So if you expose yourself, you go to the, I don't know, you might be checked by the police, or you might be so it means that you lose the job. It means that you lose the income, and very often for live-in workers, it means that you lose the home. So what do you think about this? Thank you.
Thank you very much for these questions. On the irregularity, so I did not try to account for irregularity as such. I agree that it would be an issue in various sectors in Italy. I'm thinking of agriculture, but also care, if it's like live-in care and so on. So what in principle one would want to do perhaps is to look at these sectors in particular and see if the results differ, and then try to learn something from the difference in results. But I couldn't do that because therefore, for that, I do not have enough observations. So because we're talking about essential workers as a subgroup of all workers, so then we are at 40% about of the employed population. And then migrants of that is still another small group. So if you go into certain sectors, you don't get results anymore. And that is just limited by the sample size, basically. Otherwise, I would agree, that would be interesting to look into. At the same time, So care is a rather large sector, yes. Agriculture is not in terms of employment. And so I would say these results are not somehow invalid because they don't look at that. I would say the vast majority of the employed people in what I'm looking at are in health sectors, or are in wholesale and the whole food supply chain, and supermarkets and so on. What was open then? Also some logistics. So the employment in these sectors is much larger and overall outweighs these sectors where we have to worry about irregularity, I would argue. But contagion and underreporting of being ill, yes, we very much agree there, I would say. So in the survey here, people were reporting. So the way it worked was they were asked, okay, did you go to work last week? And if they said no, then they were asked, why did you not go? And if they then they could say illness among one of many options. And I'm looking only at those. So there's no information, no objective information whether they were infected or not, or whether they really should have sort of isolated or not. I can only go by that information, and yes, it would make a lot of sense to me that people underreport this, or and keep going to work, especially when they think, oh, this is not so strong, I'll manage and so on. But I could imagine similar things, especially in the health sector, among the native born. I don't see why migrants might be per se different there, except if it's for the insecure status, which is the other thing. So about this ill going to work, which is a phenomenon, yes, that I could imagine to be quite similar between migrants and native born, but there's no result on that. Whereas the insecure status would be about migrants only. I can imagine that to have quite an impact, yes, and that they therefore underreport or keep going to work ill. Yeah.
Thank you so much. We have a question from Martin, please.
Yeah, so this is really interesting. So I've got a couple of questions. The first one is simply also in terms of the presentation strategic questions and presentations. Did you have any expectations going in at all? I mean, so the way you presented it, and maybe that is the best way to present it, is that you ask the question and then you don't really, we can speculate on the reasons, but I suppose there's some experience with what happened during other types of crisis, right? Financial crisis and migrants versus non-migrants, what happened and why, and I suppose the question is this roughly as expected, or is it surprising, or do we not just know? And then the second question is, I mean, to what extent? Well, there's two questions. First of all, so if I wanted to ask a crude policy question, which is okay, so I'm wondering, I have many migrants in those key sectors. If I was concerned with resilience, what would be, in a way, the kind of message coming out of this paper? I understood that migrants are less likely to go off sick, but they're more likely to look for a different job. So one question is whether you also have data on whether people leaving the occupation altogether. And then the related question is, again, this is maybe a kind of inappropriate question because we don't know what's causing it, or we have no idea. But is your sense that a lot of these results are quite country specific, quite context specific? I mean, is it something about the Italian context that creates this? Or if you had the data, if you did this in a different country, like in Germany or in a different context, would you expect to see similar effects?
Yes, thank you. Very good questions. About expectations. So I agree that many would say, why don't you formulate hypotheses and then you check whether they are right or not. Well, that's basically not how I approached this, to be honest. I approached this with like curiosity simply, and I didn't expect anything in particular. I thought, like, oh, I want to see if there's differences. I could imagine that there's some, but not necessarily which way they go. Now I feel a bit, if I was to formulate hypothesis, it would become really confusing. Like, what am I saying where? Because the results, as I struggled a bit to sort of make these distinctions between essential workers and other workers on the one hand, and then migrants and non-migrants on the other hand, it becomes perhaps a bit confusing if I now have also things in the paper as hypotheses that are perhaps the opposite of the results, and in some cases they would be. So yes, and I was surprised by some of the results. I was surprised that for essential workers there are quite some differences between migrants and native born. So, and in some ways, yeah, like I would have expected, if anything, that that key workers are more alike in their behavior than perhaps the rest of the population, in the sense that they are in this situation under pressure, and they sort of function as a team and behave similarly because of that. But the findings are, at least in some cases, that the behavior was quite different. Okay, perhaps also starting at different points, right? If migrants are already working full-time and native-born often are working part-time, then it's much easier for the native-born perhaps to expand their hours. Okay. But otherwise, and this is about the message about resilience, this says that, well, if you think of your essential workers in at least two groups of migrants and native-born, then these two groups might have different strengths and weaknesses. So the strength of the native-born might be to expand the hours. Their weakness might be, for example, to more often stay at home sick, which the migrants seem to do less. But their specific weakness might be that they look for another job more often. So these are things that, as a policymaker, or especially as an employer, as a hospital, for example, you can do something about. You can be on the lookout to say, okay, perhaps, with this migrant employee, I should be careful that they do stay at home when they are sick, but that they don't leave the job when actually, we could make it easier for them, and then they stay. So these are the kind of implications I think could come out of this. Is it country specific? Well, the data are all Italian. We know that Italy was, in terms of being hit by the pandemic, was a pretty bad case, one of the worst in the world, actually, if you look at excess mortality and so on. So in that sense, it was also a particular example to study to get perhaps strong results. At the same time, there's many migrants in Italy, so in many ways it is a good case to study. To what extent it generalizes is a different question. I do, at the end of the paper, I do compare a little bit to tentative other results, but they are different. But then the other results that I compared to are at the EU level, and it's really hard to interpret something that is for the whole EU with a lot of variation in terms of how bad the pandemic was among EU countries. So I would hope to see more, say, country-specific studies like this, because to do a whole EU effort would mean also having an impact variable, or ideally two, for the whole EU. And that's the impact variable was to put together was some work. You had to go to the Department of Civil Protection and download what they reported day by day during the pandemic and put it together and so on. That will be possible for some other countries, but it is not that there's a ready-made data set that you just have to apply to various countries. Yeah.
We have another question in the room.
I was wondering about, the paper focuses on sort of within region effects and eliminating the effects of regions with the fixed effects. So I was wondering if there could be reasons, this pure conjecture, for the effect of the key predictors to vary across regions, and whether this would be interesting for policy, like maybe essential migrant workers are more resilient in some regions rather than others, and could this be estimated with like a random effects model? Then the migrant native gap would be varying between regions. So for instance, some regions might have better health infrastructure, more robust labor protection, which may alter the effects between the regions, and we could then draw some policy conclusions based on that. I don't know if you have any hypotheses regarding this. It's just a question I was wondering about.
Difficult. I mean, there's always more that you can do. Well, I would hope that things like differences in infrastructure and in hospital beds per population and so on, which are there, that the fixed effects for the regions take care of this. But there were also policy differences across regions. So, and this is something I cannot integrate, but there have been interesting findings because, for example, I was doing this work in Bolzano, and that province, they were implementing at some point a voluntary, but please do mass testing, as you've otherwise seen in Korea and so on. It wasn't otherwise done in Italy that way. And then you can study whether it had an effect, and people find, yes, it had an effect. So these things, well, in my data, if I go by new death per population or current people in intensive care per population, this is the best I could find, let's say, in this context. Of course, there could be a lot more variation. Yeah, there could be different effects of the same variables across regions. But this is basically what I found was possible with the data so far. And to be honest, I expected this to be a small paper a long time ago, and it took a while to find something to actually implement the idea, because many, say, policy evaluation methods would not apply here. Everybody was affected by the pandemic. There's no control group, and so on and so on. Yeah.
Do we have other questions in the room, online? Oh, yeah, Martin.
Sorry, one other question. So I hadn't quite appreciated that. So on average, the migrants in the key sectors are working a lot more as a starting point than native born. That's what you said, right? And that then partly explains the response. But then in terms of what you're trying to do, I mean, that's interesting, but would it not make sense to compare kind of equal types of workers in terms of, or is that just not possible because there are so few? You know what I mean? Rather than comparing close to full-time versus part-timers. But among the two groups, compare the part-timers with the part-timers and the close to full-timers with full-timers and see whether there was a difference between them. So I'm not really an expert on this at all. I'm just wondering what the research says about who's more likely to go off sick, part-time or full-time. Or is there any evidence on in general, just whether one of the two are more likely to report? Yeah. So, but just to compare like with like, because anyway, I'm yeah.
Right. Yes, in principle, I guess that can and should be done. I will try to do that to basically look at full-time only, because part-time, that will probably be too small a group on at least one side, the native-born or the foreign-born, probably the foreign-born. But the full-time should be possible. At the same time, yes, I remember trying this a little bit, or trying various versions. And the variation in hours comes in basically from the part-time people, or from not like 15 hours, but 25 hours as opposed to 38 or 40 hours. So in that sense, the variation that allows me to identify something in the first place perhaps needs the lower hours reported by part-time people. But I will check again. It's a valid point. And is there anything known about who's more likely to perhaps come to work ill? I would think that's the full-time people. It's just a hunch, but I think I have seen something about that, because the part-time people have more ways to adjust, right? If they're not feeling well, perhaps they can shift or switch shifts with somebody and so on, or can the overall, say, burden of a work day, of a work week might be lower. So they find ways to adjust and be back on track for the next time they're working, while this is much harder for full-time staff, perhaps especially in this situation. But that's a hunch, yeah.
We are out of time. Thank you so much for this interesting discussion, Friedrich, and please join us for the next MPC seminars. Please join me in thanking Friedrich for this presentation.
Thank you very much.